Welcome to our guide on the digital finger application of StrataMGT, the non-hormonal, non-steroidal gel for vaginal atrophy, lichenoid dermatosis, and other mucosal conditions. Let's take a step-by-step look at how to apply StrataMGT both inside the vagina and on the external vulvar area using a clean finger digital application. Step 1. Get ready. Wash your hands thoroughly before use. Step 2. Prepare the tube. On first use of the tube, remove the cap and cut the nozzle tip of the tube. Step 3. Gel application. Apply a small amount of StrataMGT on the tip of your finger. For intravaginal use without an applicator, apply 3 to 5 drops of StrataMGT on the tip of your finger. Insert your finger gently into the vagina and distribute the gel evenly internally. A comfortable position will make the application easier. If needed, you may repeat the process with an additional 3 to 5 drops to ensure complete coverage. For external use without an applicator, apply a small amount, for example 2 to 3 drops, of StrataMGT directly to the affected external area. Distribute the gel evenly over the area without rubbing it in, as it does not penetrate the skin. StrataMGT should be applied once daily, as needed, or as advised by your physician. Reapplication after washing or as needed for relief is recommended. StrataMGT should be reapplied after each urination, bowel movement, or wash. StrataMGT is an advanced formulation that requires substantially less gel per application than typical creams or gels. One application of StrataMGT may last up to 3-4 days. The 5-gram tube contains enough gel for approximately 2 weeks supply, the 10-gram tube for approximately 4 to 5 weeks supply, and the 28.4-gram tube for approximately 10 to 12 weeks supply. Over time, you may gradually adjust how often and how much gel you use based on your individual needs and response. For more information on the product, case studies, or joining our clinical trials, visit StrataMGT.com or us.stratamgt.com for US residents.